Hi, welcome back and thanks for joining us today. Today we have a great segment. First, we'll have our clinical pharmacist, Kawana, talk to you about your medications. We know this is overwhelming, so hopefully after this segment you'll feel a little bit better about your medications and understand why they're so important for your health. Following that, we have Dr. Melissa Shep, who will be discussing palliative care with you. She's an internal physician who specializes in palliative care, and hope this brings some insight into where this may fit into your lifestyle with your diagnosis. So with that, here we go.
Hello everyone, and welcome to the Wellstar Heart Failure Academy. Today's topic of discussion will be medications used to treat your heart failure. So why are medications important? If you did not know, I would like for you to take this very important note, that medications are the most utilized tool to controlling your heart failure. And in fact, certain medications have been proven to prolong your life as well as reduce your readmission to hospital and improve your heart functions as well. Before we dive deeply into medications, let's review some very general important tips about taking your medications. For the best response, you want to take your medications every day at the same time. Doing so will help you create a pattern that helps you prevent missing doses. You do not want to skip doses even if you feel better. We know that taking medications daily as prescribed will make you feel better, so stopping some medications abruptly will make things a lot worse. There is one occasion in which we may consider you skipping a dose, and that is if you can't remember if you've taken your medication earlier that day. Doubling up on medications can sometimes make things a lot worse, and so we don't want to cause any further problems. If you're having side effects from your medication, you want to talk with your provider about it. This is because medications have side effects, and we want to make sure that we find an alternative, because 9 times out of 10, there is an alternative to medication. You want to create a system for how and when to take your medications. This will help you avoid missing doses, as we mentioned earlier. And some useful tools could be using a pill box. With the use of a pill box, you don't have to remember whether you've taken your medication or not. That medication will be placed in a specific section of your pill box, and if it's still there at the time that you don't remember, then you did not take it. Other possible tools you could use is alarms that you can set on your mobile phone. You want to make sure that you do not run out of your medications, even if you feel better. Sometimes your pharmacy may have to order in your medications, and we want to give them ample time to make sure they have your supply. Patients sometimes may not remember whether they have refills, and you may be out. So this gives your pharmacist time to contact your provider and get a prescription for you. Lastly, we want you to keep an updated list of your medications and carry them with you. You want to make any changes to that list anytime your doctor takes away medications or adds on medicines, and even change your dosage. It is advisable that you also provide this list to someone in your family or a close friend or neighbor. Doing this very important tip will help you stay safe in the time that your providers who are caring for you need to know exactly what you're taking. This slide provides the heart failure zones, and I know that you've been provided lots of information about this in prior videos, but I did want to point out that listed in your everyday activities is to take your medications as prescribed. That means this is very, very important. We want you to make it a habit and make it almost part of your lifestyle so that you don't have to stress trying to make sure you get these doses in every day. So what medications are used to treat heart failure? The first 2 classes of medicines that we will review are very similar in how they work, and so they are the ACE inhibitors, or angiotensin converting enzyme inhibitors, or ARBs, which are the angiotensin receptor blockers. These medications work by relaxing your blood vessels and lower your blood pressure and reduces the strain on your heart. This makes it a lot easier for your heart to pump and for your blood to flow. If you have a weak heart, these medications have been proven to make you feel better, make you stronger. It also helps you live longer and reduce your risk of having to go to the hospital. Examples of the ACE inhibitors are those medications ending in pril, P-R-I-L, like lisinopril. And the ARBs, like losartan and valsartan, ending in tan, T-A-N. Some side effects associated with these medications include low blood pressure, increased potassium level, as well as dizziness upon standing. You could also have a dry cough that's associated more with the ACE inhibitors or those ending in prel. A rare but serious side effect associated with the ACE inhibitors also is the risk of swelling, such as in your lips or mouth, that can occur at any time during therapy. If this should occur, this would be considered a medical emergency and you must seek help as soon as possible. The next medication is Entresto, and it is a medication in a class by itself called the ARNIs, or angiotensin receptor neprilysin inhibitor. This medication includes valsartan, which is an ARB, which we talked about in the prior slides, as well as sacubitril, which is a neprilysin inhibitor. This part of the medication actually helps helpful chemicals from being broken down in your body. So there are some chemicals that are released to help your blood vessels dilate and keep your blood flow from going to the rest of your body. So you want to make sure that we can block the breakdown of those medications by the use of Entresto. So the combination of the two medications help to relax the blood vessels as well as decrease sodium and fluid buildup in the body. If you have a weak heart, this medication has been proven, in fact, to be just as good or better than the ACE inhibitors and ARBs that we talked about prior at helping you to live longer and lessen your chances of going to the hospital. The side effects from this medication is very similar to those of the ACEs and ARBs, so we won't review them since we did that in the prior slide. The next class of medication are the beta blockers. These medications work by blocking chemicals that make your heart work too hard. This medication class includes 3 medications that have been proven, and they are bisoprolol, carvedilol, and metoprolol ER. Taking these medications if you have a weak heart has been proven in combination with the meds we just talked about at helping to make your heart stronger, help you live longer, and reduce your readmission to the hospital for heart failure. Possible side effects from this medication can include low blood pressure, decreased heart rate, as well as weakness or fatigue. The weakness and fatigue that occurs can occur early during when you may have had a dosage increase or the medication was just started. So we are aware that this may happen, but it tends to self-correct itself within a week or two. If you should not feel better, you want to reach out to your doctor to make sure that everything is going well. If you are diabetic as well, while on beta blockers, you want to make sure that you're checking your blood sugar regularly. And this is because beta blockers can block the symptoms of low blood sugar, such as trembling and racing heart or shaking. However, it will not block symptoms such as sweating or just overall not feeling well. So if you notice that you're sweating, you want to make sure that you check your blood sugar to make sure that it's not too low. You want to also keep in mind that you should never abruptly stop taking a beta blocker, because this can make your blood pressure go up very high and could make you go into a heart failure exacerbation. Always talk to your doctor first so that you can come up with a plan for how to stop the medication. Aldosterone antagonists are medications such as spironolactone and eplerenone. These medications block the effects of chemicals that damage your heart. They decrease the amount of sodium as well as water that your body retains by blocking a hormone that makes you hold on to too much salt and water. The benefits of this medication is that it also can help you to feel stronger, make your heart stronger, decrease your risk of early death from heart failure, as well as hospital readmissions. Possible side effects from this medication could be a headache, dizziness, or even increased potassium levels. Another side effect that is more common in men with spironolactone is breast tenderness or swelling. If this side effect should occur, your doctor has the option of switching you to eplerenone to help with that. The next class of medication are the vasodilators. These medications work by dilating the blood vessels, and doing this decreases the heart's workload, allows the heart to be able to pump the blood throughout your body without stress and strain. Example of this would be hydralazine in combination with isosorbide dinitrate, and the brand name of this medication is Bidil. If you are African American, this medication has been proven, if you have a weak heart, to make your heart stronger, help you to live longer, and lessen your chance of hospital admission. Some side effects associated with the vasodilators include possible headache, low blood pressure, as well as flushing, which can present as skin redness as well as warmth. And this type of side effect is usually temporary and should improve over time. Many of you may be able to identify with the symptoms of swelling, such as in your legs or feet, or even shortness of breath. And this next class of medication is going to help us with that type of symptom. And so diuretics, also known to many as the water pill, is a symptom relief medication. This medicine helps to rid your body of water as well as salt. Patients who have heart failure will typically be on a diuretic at some point during their care. Diuretics typically work in different ways by relieving the fluid at different rates as well as through different methods. But the most commonly used diuretics are those such as the loop diuretics that include medications like Lasix or furosemide, torsemide, or bumetanide. The most common side effect is increased urination, as well as low sodium and potassium levels. The patient can have slow kidney function as well as dizziness and lightheadedness. It is very important while on a diuretic that you're monitoring your weight as well as your symptoms of dizziness so that you can alert your provider when a dosage change may be needed or an assessment may need to occur. Potassium is not specifically used to treat heart failure. However, it is used to maintain normal potassium levels from the loss of potassium due to the use of diuretics, such as those like the loop diuretics. As urination increases, so does the loss of potassium. Some possible side effects from potassium include increased potassium levels, stomach upset, as well as nausea. Digoxin is a medication that may be used if you're not feeling well even while on other medications. This one helps to make your heart beat with a stronger force of contraction with each heartbeat. So it provides the strength your heart needs to pump the blood throughout the rest of your body. If you have a weak heart, this medicine can help to make you feel better as well as lessen your chance of having to go to the hospital. Possible side effects from digoxin could be nausea, loss of appetite, as well as visual disturbances, such as blurred vision. The last medication we will discuss is Korlynor. And Korlynor is a medication that specifically works to decrease your heart rate, sort of like the beta blockers. However, this medication is used when your heart rate is greater than or equal to 70 while on a beta blocker at maximum doses, or if you cannot tolerate a beta blocker. It has been shown to help patients feel a lot better as well as reduce their readmission to the hospital. The side effects associated with Korlynor includes low heart rate, increased blood pressure, as well as visual disturbances. There are many over-the-counter medications that you want to be aware of that you should avoid while having heart failure. Examples of these include non-steroidal anti-inflammatory drugs or NSAIDs, such as Motrin, ibuprofen, Advil, naproxen, and Aleve. However, you may still take medications like Tylenol as long as your doctor has not told you you have problems with your liver. You should avoid NSAIDs because these medications may make you hold on to too much salt and water and may also interact with medications used to improve your heart failure. You should also avoid cough and cold medications like those including decongestants such as pseudoephedrine and phenylephrine. Examples of these would include Sudafed, Claritin D, or Dayquil. The use of these types of decongestants can increase your blood pressure, which may make you have a heart failure exacerbation. So you want to avoid these medications as much as possible. You may take medications like Coracetin HPP, which is formulated specifically for patients with high blood pressure, as well as medications like Mucinex and Mucinex DM. For nasal congestion, you may consider using medications like nasal steroids, such as Flonase, or even using nasal saline. Follow-up appointments are particularly important, even if you feel better. As I mentioned earlier in the slides, some medications have side effects that require lab monitoring, so you want to make sure that you go to your visit. This also gives your doctor the opportunity to monitor your progress. Keeping your appointments can help you to avoid a readmission to the hospital. So what should you bring to these appointments? You want to make sure you bring your medication list as well as bottles so that your provider can see what medications you're taking at home. You would also want to take self-monitoring weight and vital sign charts and reports so that your doctor can see how well you're managing your heart failure at home. I also encourage you to write down any changes in your symptoms as well as questions that you may have come up with while you're away from your doctor, so that he or she may be able to answer your questions while there. Lastly, you want to take any reports that you've obtained from other providers' offices, such as labs as well as other test results or imaging. This concludes the heart failure medication therapy session. It has been my pleasure to bring you this very important information.
Hi, my name is Melissa Shep. I am an internal medicine physician who specializes in palliative care. So I'm here today to talk to you about palliative care and what it can offer patients. Palliative care is a medical specialty. The specialty focuses on providing relief from the symptoms and stress of serious illness. The goal of palliative care is to improve quality of life for both patients and their family members. Palliative medicine seeks to do this by focusing on managing distressing symptoms that can affect your day-to-day quality of life, but also providing support in the way of helping you cope and understand the information and all of the choices that often people have to make as they move through the course of their illness. So many people, when they hear the word palliative care, associate that with hospice. So I wanted to up front just address what the difference is between hospice and palliative care, because they are not the same. Hospice is a resource that cares for patients who are nearing the end of life when the main goal in their care is their comfort and being at home with loved ones. Hospice is reserved for those patients that may have less than 6 months to live, so it's highly dependent on a patient's prognosis. Palliative care, however, is available to patients at any point in their illness. It is not dependent on prognosis. Palliative care can become a part of your care at any time that the illness is affecting your quality of life. We work in conjunction with your current care team as an additional layer of care. And patients do not have to have a less than 6-month prognosis to have palliative care. So what can we do for you? I wanted to get a little more detailed about what exactly palliative care does for patients. We know that the doctors that are treating your main medical problems, such as heart failure or other problems, are delivering to you state-of-the-art care. And so we know that those disease processes are being treated to the best of our ability. Sometimes, though, there are other issues that crop up that can affect day-to-day life. A lot of times those things are symptom-related, such as symptoms of pain, shortness of breath, nausea, vomiting, constipation, diarrhea, anxiety, depression, not eating or sleeping well. So those are the things we focus on, the things that we can indeed influence and change to make your day-to-day quality of life better. We also focus on education. We try to educate you and your family about what's going on with your health and help you to be prepared for the future. We spend a lot of time exploring your knowledge of your condition and your wishes regarding your medical care, and we make sure that your wishes are known to your medical team. We oftentimes assist with the completion of advanced directives, and we coordinate referrals to useful supportive resources if those are needed as time goes on. We generally work in a team. The team can consist of physicians, nurse practitioners, social workers, sometimes a chaplain, sometimes a pharmacist, nutritionist, and those people are specially trained to take the needed time to talk to you about your illness and what it means to you, so that we can combine our medical knowledge with what you know and understand about your illness and make a good plan of care for you. A typical first visit with palliative care is about an hour, and so we do tend to spend a lot of time talking and communicating about your unique situation. We offer family meetings to help to be sure that everyone involved is on the same page, and that is one of the key tools that we use in palliative care to make sure that you and your family feel as comfortable as possible with what's going on medically. So palliative care can take place in a few different settings. Your doctor may recommend a consultation with palliative care, or sometimes you're the one who prompts the request, and you can ask your doctor or nurse for a palliative care consult. So these types of consultations can take place in the hospital. We have palliative care teams within the hospital who can see patients, but we also have some outpatient resources. We have a palliative care clinic, we have the ability to see patients in their homes, and we have the ability to see patients in certain nursing homes. So overall, our job is to make sure we understand what is important to you and what brings meaning to your life. We also want to know how your illness is impacting your quality of life and causing you any degree of suffering so that we can help. We can help you develop a plan of care that includes treatment of bothersome symptoms for day-to-day well-being, as well as an understanding of the best path forward for you.
Thank you so much for joining us today. We hope you found this helpful. Hopefully you have a better understanding of your medications and some other treatment options that may help you along your journey. Thank you so much. Our next segment and final segment will actually be on exercises and the importance of sleep health. Thank you so much. Until then, be well.